I'm not happy, but I don't know why. If you have an avoidant attachment style, then you won't be hurt.
Right.
But it's like you actually have already been hurt.
For me to go to therapy versus still relying on my friends or family, when is the time to switch over to therapy?
Why am I not fixed? And they almost want a magic wand to come in and just fix you like that.
If you're not able to solve something on your own and you've been at it for a while,
You are feeling depressed. You're feeling really down. I'm sorry. You have to get up and go to work. That's really hard. But it's also your job.
what do you think of people using ChatGPT as a therapist? How would you convince me?
We have these horrible, horrible ideas from years and years ago of these mental institutions.
And how do you find the right person in that sense?
You're right. If that person does not respect them or they don't understand your culture during your therapeutic journey, get rid of them.
So Julia, this conversation has been amazing. Like, these are a lot of questions that I had in my head about therapy,
Yeah.
and you've answered a lot of them. Does it still mean that therapy is where you're broken?
I don't know. What do you think?
Okay, everyone. I've always been the kind of person who thought that therapy is for broken people. And today, and in the last few months, I've had a change of mind. And I'm still on the fence about it, but I had someone who's like an expert come here and tell me what it is. Thank you so much for coming here, Julia. She's a licensed psychotherapist, and she's gonna bust all the myths today for us.
Thank you for having me.
Okay, so Julia, tell me about yourself.
I'm a licensed psychotherapist and I'm a child development specialist. I trained at Montefiore Medical Center and I went to graduate school at NYU Silver.
And why did you get into therapy?
It's a good question. I think that ever since I was a little child, I was always drawn to helping people. And by the age of probably 10, I really admired my own therapist that I was going to. And I actually asked her at that moment, how did you get here?
You've done a lot. When I spoke to you on the phone, I was just like, this is impressive. Like, you just don't do it for the sake of it. Like, and especially in this field, like, you have to be like driven and you have to have that purpose. And I like, when I spoke to you, I was like, this is so impressive, the kind of work you've done. And like, I want to get into it. But before we get into that, what are like the myths about therapy that people have?
There's a lot. I think one of the first ones that you even said in your introduction is that therapy means that you're broken.
Right.
And in fact, I think it means the absolute opposite. I think that when you commit to therapy, you're first committing that you have a problem. And
Right.
like, as we all know, all the 10 steps, that's the first step to recovery. And so many people can't do that. Like the diagnosis of narcissism, which so many people have, especially in New York, so many people don't know that narcissists don't really get treated. And that's because they can't admit that they have the problem. So they never go for therapy. They never get help.
Okay.
So to be someone that's that vulnerable and they have that emotional insight into themselves and knowing that something's wrong, that's so valuable. I think another myth is that therapists are going to judge you. I think that people think I need to go to someone who's older than me, who's wiser than me, and who's going to tell me what to do.
Mm-hmm.
And that's not the role of a therapist at all. And I think that if you have that thought in your head and you have that idea, like you're not in therapy for the right reasons.
But then what is the role of a therapist?
So the role of a therapist is to meet you where you're at. I think that no one wants to force you and tell you what to do and what not to do. It's really to help you process and understand yourself better. I think a lot of people think that it's like, I have to be super anxious, I have to be depressed, I have to have bipolar disorder, schizophrenia. But no, it's like maybe your thoughts are just too much to deal with at the moment.
Mm-hmm.
Maybe you're just feeling down and you want someone to speak to. I like to tell people it's a lot like going to the doctor.
Mm-hmm.
When you're sick or you're run down, you go to the doctor, you tell them your symptoms, and then you get better.
Right.
So if your mind is feeling run down, why can't you do the same thing?
I agree with you in a lot of sense, but my thought here was that a lot of people think that therapy is something that, like, if you look at it from a lens of someone who's like in, say, like a third world country, or like someone who has like a really tough time in different countries where there's no food, where there's no shelter.
Yeah.
I feel like there the thought of mental health doesn't really come in. It doesn't kick in. And that has to do with the Maslow's hierarchy That's what my thought is, that you have like your basics covered. But when you reach that stage where like you have your shelter, when you have your food, when you have everything around you that's set, then it's like just your mind and you. And that's when a lot of people come to the realization that, oh, I achieved what I wanted to, I'm on the right path of life, but now like there's something still wrong. I still don't feel that happiness.
Yeah.
And I think that's when people start to question themselves, thinking, I'm broken. I can't reach out to anyone. Like the entire point of life, the way it was drilled onto me was I have to get somewhere.
Yeah.
And even if I'm on the path for it, even if I see the light at the end of the tunnel in terms of the achievement I want, the mind is still working differently.
You're right.
Right?
Yeah. A lot of people come in and they even say, I'm not happy, but I don't know why.
Right.
And it's like a lot of times it has to do with what's the underlying issue. What's the root of the problem?
Mm-hmm.
Or is there a fear underneath? Is it something that happened in your childhood that's affecting the way that you interact with everyone around you? What is it? But
Right.
I also want to touch on something that you said too. I think therapy is a privilege.
Right.
Other countries don't have it. It's not as common in some of these third world countries. All that you're focused on is a roof over your head, is food on the
Survival.
table, survival. So it absolutely is a privilege.
Right.
Yeah.
And like you said something about the childhood. I think therapy has to do with everything related to childhood, right?
Absolutely.
I believe I'm not even sure if I'm getting this right. There are 4 attachment styles?
Yeah. So that's what I studied when I went to Montefiore Medical Center.
Okay.
We studied attachment styles, and it's very interesting. There's attachment styles differ when you're a child and as an adult. They're definitely similar, but they're a little different in terminology. So when you're a child, there's 4 attachment styles. There's secure, and that means that your parent or your caregiver is acting as a secure base. And a
Okay.
secure base is the clinical term for someone that you can turn to when you're in a situation that's new to you, you feel uncomfortable, it's an unknown area, unknown people, you can go to that person for comfort. And it's even sometimes just seeing that person across the room and knowing that they're there, and that it gives you the freedom to explore and to interact with others. But unfortunately, especially in the population that I worked with, which was extremely traumatized children, a lot of them experienced physical abuse, emotional abuse. Some of them were traumatized sexually. A lot of them did not have secure attachment. And so the other forms of attachment is there's disorganized, which is where you kind of are doing a little bit of all the attachment styles. You don't know what to do. You might be clinging on to someone who's completely not your caregiver. It
Right.
could be the therapist in the room you feel really close to. And then sometimes you're going to go to your mom, sometimes you're going to ignore her. And then there's avoidant attachment style. Avoidant attachment style is when a child is avoiding their parent. They don't want to be near them. They want to be away from them. They don't really want anything to do with them. They don't get any comfort from them. And then there's something that's also called resistant. And this one's a little bit tricky, and it's harder to identify in children because they get very upset when their parent leaves the room, but then when they return, they don't want to be with them. They don't want to be comforted by them. A lot of times we see this with children who are neglected. They're searching and they're longing for that attention and that comfort, but then they're so unused to getting it, so they don't know what to do when they do.
Okay.
And then how this relates now into adult attachment style, there's a direct correlation with that. And then that, like you said, it is anxious, secure, avoidant, and disorganized. And that makes a little bit more sense when you think about it. There's not as much clinical terms. It's like secure if you have a secure relationship, and anxious when you really want the person's attention, and when they're not giving it to you, it makes you extremely anxious. That's what I feel like we hear a lot in today's social media and today's society. Disorganized is very similar to as a child, and avoidant is those people where it's really hard for them to give love and to receive love.
Right. I feel like there's also this movement of pride that comes with people who have, I don't know, I've just seen it. And there's a lot of people who say that, oh, I have an avoidant attachment style. And that makes them seem like, oh, they're not that invested in any sort of friendship or relationship that they have. And it makes them seem cool.
Yeah.
But I think in the end, like, it's kind of robbing them of, like, just like a good friendship or like a relationship.
It is. And I think they don't realize the clinical side of it.
Right.
Like, there's a reason why you have this avoidant attachment style.
Right.
There's a reason why you can't let someone in, why you fear that, actually.
Right.
And that's a problem in itself. But I think that society has kind of named this as something like, oh, if you have an avoidant attachment style, then you won't be hurt.
Right.
But it's like that you actually have already been hurt. And that's why you have it.
That's such a nice way to put it. Yeah.
Thank you.
So here's what I think, like, with all these attachment styles, it has to do with your childhood, right?
Absolutely.
But even then, like, when is the right time to realize, like, I'm an adult now? For me to go to therapy versus still relying on my friends or family,
Yeah.
there's a fine balance. And when is the time to switch over to therapy?
I think if you're asking yourself that question, then it might be a good time to look into therapy.
Okay.
I think that leaning on your friends and family is so important. Like, we all need a support system, and
Right.
without it, life is so much harder. But if you catch yourself relying on them for many different things and always turning to them, always venting all of your issues, that's a problem. We call it protective factors, and so to have all these protective factors, like a loved one, like a best friend, like a colleague that you can really count on, is great, and that's going to help you in the therapeutic process, but those aren't the people that you should be turning to.
Mm-hmm. But what about something like, is that only to do with one attachment style? Or is it like you could have all 4 attachment styles and still have the same behavior when it comes to you wanting therapy? Because my thought is, if someone has an anxious attachment style, they rely a lot on their friends and family. And at that point, making that switch over to therapy is even more scary than someone who's an avoidant, who doesn't want to rely on anyone.
Yeah.
So where's the fine balance on that?
I think a lot of people don't know their attachment style.
Okay.
But I think if they are labeled as someone like who, or even if they label themselves as anxious, it has to do a lot because they actually are anxious and they're seeking this validation and this reassurance from family and friends. And I think after a time, when you keep searching and wanting that validation, it's so exhausting. Like, you're so
Right.
tired. You have all these intrusive thoughts in your head. You are constantly ruminating over things. And when you go to therapy, now you're deciding to change that thought pattern. Now you're deciding to open up to someone, which is so difficult, but you're telling them your inner thoughts. And now
Right.
you're going to learn strategies and skills and interventions to help these thought patterns and change it to make it more productive in your life.
So it's like, it's really hard to rewire your system, like 20, 30 years, 50, 60, whatever.
Yeah.
It's like you've grown up this way, you've lived a part of your life
Yeah.
this way, and then when you're faced with this decision that the support system that I was relying on isn't doing it for me.
Yeah.
Now, it's not that they're wrong for me.
No, it's not at all. And it's
It's like-
great that they're supporting you.
Right.
But you need more.
Yeah. And how do people deal with the fact that their support system could also have like some sort of
Yeah.
issues with them switching over to therapy because they're kind of used to helping them?
Yeah.
And I think that would be more of like a child-parent relation where the parents are like, it's an assumed responsibility that my child is mine, I take care of my child, and suddenly they're like, I'm not able to give my child what they want.
It's hard. I think that it's interesting. You'll see some cases where the parent actually feels jealous, and they're like, and it's understandable. Like,
Right.
I can understand that you being jealous of the therapist because now your child is opening up to someone who they don't even know that well, and they're not the one who takes care of them, who has been there for them, who feeds them and loves them, and now they're opening up to you so much and not me, and that's really hard to deal with. So it's almost like the parent needs to be secure in themselves and secure in their role as a parent to then allow their child to go into this room and fully open up and talk about whatever they want.
Right.
And it's very interesting working with kids because while you always want to protect the confidentiality of the child, you also have to give the parent reports and feedback. So what I like to always do is have some meetings with the parent and ask them, what are your observations of the treatment? how do you guys think it's going?
Right.
And a lot of times they'll come to me with 20 million questions, and they'll be like, what did he tell you? What did she say? Did she talk about me? Did she say about this? And I'm like, you know, what we talk about in our sessions, I promised your child that I'm not going to report word for word unless there's a safety issue. But I can give you general themes of what we talk about. So then you know, and then you can also implement some of those strategies into everyday life with with your child.
I think the parents also come from a place of like goodness. Like if they're
do.
like, oh my God, my child is going through something and I can't even know what's happening.
Absolutely.
They're just like, tell me, like that's the first thought that comes to their head. They're like, I want to fix it.
Yes.
And you have probably like the toughest job, like when you have to be like, look, I can only give you certain information because at this point your child is also a human being. Like I have to consider them as like a patient of mine.
Yeah, we call it the therapeutic alliance. And I'm building an alliance with your child.
Right.
And I need them to trust me. And that means that I can't go and tell you everything that they're saying to me because I want them to feel free to open up. But I promise you that if there's any form of safety risk, you will be the first to know.
Okay. That's amazing. And yeah, that's a lot of perspective to think about.
Yeah.
So coming back to what it means, does it still mean that therapy is where like you're broken?
I don't know. What do you think?
I think if you're not able to solve something on your own and you've been at it for a while and it's related to your mental health and you've gone to the world for advice, just do therapy. Like it's another source of advice.
Absolutely. And a lot of times when you're at something for a while and you can't figure it out, sometimes it's out of your control. And that's like these thoughts. Like anxiety is when you can't control your thinking. OCD is when these intrusive thoughts and these compulsions come over you and you don't have control over it. And some people are born with that and some people are not. Some people develop it later in life because of a big stressor or a trigger and they don't know how to get rid of it. And some people never have it, and that's amazing for those people. But if you do have it, why not get skills and strategies to help you?
So would you say like everyone should get therapy?
That's a good question. No, I wouldn't.
Okay.
I think for the most part, you have to want to get therapy if you go and get it. I think that it's really difficult when you're working with a client who is not emotionally invested, who is just going because they're forced or because they're told that that's what they should do. I think that sometimes that work is so much longer and harder. And then you're looking at years for this person finally getting to trust you for then the work to start.
Right. And yeah, I agree with you. Like if it's not coming from within, no matter how much, it's again like pushing your kid to like go for like a tennis class. Like
that's what I was going to say. What about working out? Like we think of like, should everyone work out?
Yeah.
There's so many scientific benefits for it.
Right.
But you can't force people to do it. And if they don't want to, and many of my friends say I never entered a gym and I don't want to. And some of my friends are religious soul cycle every single morning at 6 a.m. But if you can't force the person to, then you shouldn't.
So how, like, just like picking up on that gym example.
Yeah.
You and I both know like going to the gym is like really important, or any sort of fitness is important.
Yeah.
But if I'm someone who doesn't even know the benefits, like there's one point where you know the benefits, and I think everyone does know the benefits of fitness.
Yeah.
But then there's the other side, which is like the experienced benefits.
Yeah.
Like if someone were to tell me like 5 years back that going to the gym is like going to be healthy for you, I'd been hearing that for the last, I don't know, God knows, 20 years of my life.
You're right.
But when I started going to the gym, there was like the difference that I actually got to see.
Yeah.
So same thing with therapy. Like at this point, I've never done therapy. But if I had to go in for therapy, what would you tell me? Like, how would you tell me like this is the best thing for me right now?
Absolutely.
And how would you convince me?
You bring up a great point. I think most people don't even know what therapy looks like.
Right.
I think we have these horrible, horrible ideas from years and years ago of these mental institutions where someone would come with a clipboard and ask you all these questions and then give you medication.
Right.
And that's not what it is. I think what the first session is what a lot of people don't understand.
Right.
I think that the first session, we call it an intake. And an intake is different than all the other sessions because a lot of times from a liability standpoint, if practitioners accept insurance, they have to do a pretty in-depth biopsychosocial assessment of the person.
That's a really fancy word. What does that mean?
So basically that means I just need to know a lot about you. I need to know your past mental health, your past physical health. I need to know a little bit about your childhood, your education, your symptoms, because I have to document that. And so I think it's hard too because sometimes people don't get a great first impression of the therapist.
Okay.
So I like to always tell my clients, like, I'm going to be asking you a lot of questions right now. I'm going to be writing a lot of things down, but I promise you our work together is not going to look like this.
All right.
And we can get into little pieces like why you're here. Tell me about your family. Tell me about your husband. Do you have children? Like, what's your role like as a mother? But we're not going to dive deep yet. That's what all the sessions to follow. But it's also for me to give a quick diagnosis because sometimes we have to put something just as a placeholder so that the insurance pay you and so that you can get reimbursed. And I just need to have a background of you.
So how do I prepare to go for like a first therapy session?
I think that you need to think, what do you want out of therapy? And what do you want out of a therapist? I think that I try to always ask my clients, what are you looking for? Because I can alter my style a little bit to accommodate that person. Like if you're someone who just wants a listener, that's okay. Then I can listen more than talking. If you're someone who needs concrete skills and maybe even homework to focus on during the week to then come back and talk to the next week about, then I could do that as well. If you're someone who wants a mix of both, if you're someone who wants psychoeducation to learn more about different diagnoses and what you might be struggling with, I think knowing what you want is so important. And I think being honest, like just going in and telling yourself, I'm going to be honest in this situation, like I'm here for a reason, and I'm going to tell this person what's going on.
So, again, like it comes back to the same thing for me. Like there are so many things that if you say that if you want to be a listener, if you want to be like someone who gets concrete solutions, people don't know that. Is that told in the first session that, or before coming, that how do you want to work?
No, it's not always.
Okay.
And I think that's a bit of a problem too, is finding the right person. Like there are some therapists out there that are better than others. There are some that are a little bit more old school. I think some work extremely clinically and they want to just give you more of the diagnosis. Then there are some like really incredible ones too, who really want to get down to the root of the problem and really want to understand it psychoanalytically and understand and educate you about why you're feeling that way.
So is cultural relatability also a part of it? If someone in the US is like born, like say like a Mormon, and they go to someone who's, I don't know, like of an entirely different religion, like say like a Hindu.
Yeah.
And that has so many factors that could be just different, right?
Yeah.
So how do you like, I feel like the biggest part of, at least for someone who's not done therapy, when it comes to finding the right therapist, cultural relatability is so important. And how do you find the right person in that sense?
You're right. I think that it's really important. I think that expressing your needs right off the bat, if that person does not respect them or they don't understand your culture or they're giving you any sign that they're not going to be receptive to that during your therapeutic journey, get rid of them.
All right.
I think that that's extremely important. Yeah.
The best solution is to actually find someone you're comfortable with, right?
I think it's both. I think that it's also like, is there a reason why you only want that type of therapist? If it's just because you feel so much more comfortable with them, then okay. But if you're open to getting to know someone else and you're open to kind of feeling out that vibe with them, then I think you should give it a chance. Because I think a lot of it is like the feeling that you get when you're with a therapist.
Okay.
Do you want to feel warm? You want to feel safe? You want to feel like you can just talk without judgment? You want to feel heard?
Right.
And I think that's most important.
No, I completely get that, but I think people operate differently when it comes to going for therapy and the kind of therapist they want.
Yeah.
Like if I think of it, if I go to a therapist and the therapist just like too awfully nice to me and is just like too understanding, I will
Yeah.
not enjoy it.
Yeah.
Like I'm being honest, I would rather have someone who tells me that, like obviously I want someone to understand me, but I also want something where it's beyond just like understanding. It's like, just for example, if I'm not able to wake up at 6 a.m. because I'm just like, the world is so silent at that point. It's so lonely. I don't want to wake up at 6 a.m. And if I reach the therapist and they're like, oh, it's so sad that you feel that way and all of that. That's the lens I look at therapy with.
Yeah.
Where it's someone who is just like treating me like a kid.
Yeah.
And a lot of people need to understand that that's not always the case.
No.
And
It really is. That's half of that's half of the
Right.
treatment. Half of it is validating you.
Right.
Like, it is really hard. You are feeling depressed. You're feeling really down. I'm sorry. You have to get up and go to work. That's really hard. But it's also your job.
Right.
And what are we going to do about it? Like, how can we help you feel better to get up and do that? Because right now, that's what you have to do. And I think it's kind of giving them those strategies and acknowledging that this is really difficult, but we can move past this together.
Right.
And let's talk about it. Let's figure it out. How do we do that?
Most people, like, that's what I'm trying to understand is, and it's kind of making sense to me now, is that when you walk into therapy, a lot of people don't want to be framed as the victim.
Yes.
And the way you're explaining it to me, it kind of helps me understand that. Because, like, I always looked at therapy with that lens, where I'm going to be looked at as the victim of something. But to be honest, if I'm going there, there is something that I have a problem with.
Yeah.
And they are there to fix it. And the first thing is, like, the hardest part for me to feel is, you're telling me the problem. And
Yes.
just hearing the problem in itself is like making me defensive.
Yeah, it is. And it's amazing that you said that, because it made me think of something really important that I learned when I was a student. When I was working with these individuals who experience such trauma and such hardship in their life, a lot of times I caught myself writing victim or saying victim, like whether it was my personal notes or something. And I had a supervisor come to me and she was like, they're not a victim. And I was like, what do you mean? Yes, they are. She's like, they're a survivor. So if you
Okay.
change the word from victim to survivor, it makes all the difference.
Right.
And so, like, you're a survivor of anxiety. You're living with that every day. You're a survivor of depression. It's not that you're a victim of it. You're getting through it.
All
And I
right.
think changing simple words like that can really make such a difference in the way that you view mental health.
Now that's such a nice way to put it.
Thanks.
Yeah. Okay, now the fact that is, now I'm in my first session, all right?
Yeah.
Or even my 10th session.
Yeah.
What are some realistic expectations I need to have that therapy can fix this and therapy can't fix this?
Yeah. That's a good one. I think that a lot of times you'll get someone, sometimes it's a parent, sometimes it's an adult, and they'll come to you maybe like the 5th session and be like, why am I not fixed? And they almost want a magic wand to come in and just fix you like that. But that's not what it is.
Mm-hmm.
It's not like that. It's that over time, you're learning more about yourself. Over time, you're understanding your thinking patterns more deeply. You're being able to stop yourself from obsessing and being able to label that as like, that's an OCD thought. I'm going to just put that to the side right now. I'm not going to give in to that. That's my anxiety. Where's the proof behind this thinking? And if you can't come up with it, then you can tell yourself, that's just my anxiety talking.
I like that. You know, like when you're saying that, I think of some things like I did, well, like not exactly that I did therapy,
Yeah.
but I'm like a really obsessive person. When I find something that is like a problem and I'm like really obsessed about it, I will not stop. I have to get it done.
Yeah.
And sometimes I see a lot of problems where I'm just like, lately I'm like, you know what, this is not in my control. Like I can't
Yeah.
keep obsessing about this.
Absolutely.
And it's time to like stop. This is not in my control. And there's like this itch in me where it's like, should I stop?
Yeah.
But then it's like, you have to back off.
Yes, and that's what therapy can teach you. And you can talk about that because it's not something that just is going to go away overnight. It's something that you're going to learn to live with.
Right.
And it's like when you're meeting for one session a week for 45 minutes, it's not going to entirely change your life. But if you're there and you're present and you want to work on it every single day, 24 hours of the day to be your best self, then that's how you're going to get help.
So if I'm like anxious or avoidant or
Yeah.
any of the other types that you said, it's not that I'm going to go there and be like, if I'm anxious, I'm not going to be anxious after therapy. I will be anxious, but do you say that I will know why I'm anxious and I will learn how to like address the fact that, okay, this makes me anxious. Here's why it's happening. And now that I know why it's happening, I can still make a choice whether to stop the flow of this
Yeah.
or continue the line of anxiety.
Absolutely. I think that so many people don't even understand their triggers.
Right.
And it can take a long time to know what are my triggers because sometimes it's unconscious. But when you start to point that out and when you talk in detail about, oh my God, my heart started beating, my face was flushed, I was sweating, it was so hard, and you tell someone in detail, you're really processing what just happened.
Right.
And you're really getting down to the deep work and you're really understanding this is what happened, this was the trigger, and now this is how I'm going to help myself.
Okay. That makes sense.
Yeah.
Yeah. It's like really a lot of things that I didn't know about it today that I'm like finding out. Like these are like deep questions that I had about therapy and like it's really been helpful at this point.
Oh, I'm so glad. A lot of
Yeah.
people have them too. And I think it's such a taboo in general. Like therapy has been looked down upon for so many years. Like, why go to a therapist? What's wrong with you? I think especially for men, I know so many dads feel different than moms about sending their child to therapy. Or I have so many dads attend or so many moms attend the sessions and the dads won't. But it's like therapy is there for a reason. It's there to better you. It's there to help you become your best self. So why not learn more about it? Why not talk more about it? Let's normalize it. Let's normalize going to therapy and getting help.
I agree with you, but the thing that you said about the men, I saw this video once which said that like men and women look at therapy in different ways. And the reason for that is, and obviously it's a generalization, everyone's different, but largely it's the fact that women, when they talk about problems, they're okay after that. Men, at least for me, I feel like if I just talk about my problem, there's nothing that's changing. And there's nothing that's coming out of me just talking about the problem. And I still feel the same way. And I'd rather be in my head thinking that, oh, if I have to get a new job, talking about the stress of getting the new job is not going to get me the new job.
Yeah.
Versus if I get the job and I put the effort for it, I might actually get it. And you can correct me on this. Here's what I think about the way women deal with it. Women will talk about the stress of the job, it lightens them, and then they also get back to action. They also find the job, they get back to putting the effort. Men just skip that phase of, talking about the problem.
Yeah, I think that they do skip it. I think that sometimes women feel more comfortable because society has made that stereotype that women can go out and gossip. They can go out and talk to all their friends about all their problems, and they can go to therapy. I think
Right.
that's absolutely true. But I also think that women are experiencing the same thing. It's not always just enough to just talk about it.
Right.
Because when you're talking about it, yeah, it's amazing. You're getting it off your chest. You're being able to express yourself. But what do you do about that?
Right.
Like you said, the problem's not gone. But it is half the battle being able to tell someone. And men don't always feel comfortable doing that.
They feel like they're being weak.
Yeah,
I'll be honest, like I
Yeah.
feel the same way.
yeah. It's hard. It's really hard. And I wish and I hope for the future of our worlds that we're able to normalize it more because men deserve therapy just as much as women do.
At this point, I feel like it started to head to that point where men kind of needed more than women.
Yeah, I could see that.
Yeah. I don't know.
Yeah.
So coming back to getting the right therapist, When I was speaking to you, you told me that there was someone you knew who went to like 10 or 15 people
Yeah.
with the same problem.
Yeah. It's hard. I think it's really difficult for someone when they're trying to find the right therapist. I think that there's actually like a search engine called Psychology Today where you can narrow down your search by the specialty that that person has, if they accept insurance, how much they pay, and the area. I think a lot of people don't even know that this exists. But I think that when you go on that, you need to really be careful and really look into the person and read their bios. I think that you need to know what you're looking for and not just say yes to the first person that you see or not say yes to 10 people because it's exhausting. If it takes you 10 people to find the right person, by all means, do what you have to. But I think it's emotionally really draining and difficult on the client to have to open up about their story 10 different times.
It's like you go to 10 or 15 people, you're already feeling bad about something.
Yeah.
And having to repeat that problem to a new person every time will probably drain you. And the reason that you went there was just because you weren't understood by anyone else. And then you went there hoping to get understood by like 10 or 15 people. And that also didn't happen. So then it's just like a self-fulfilling prophecy where you're like, I am broken.
Absolutely. And then you feel stuck too. Like, where do I go from here?
Right.
So I think it's really important that you do the research beforehand and you find the person that's right for you. And there's a lot of reviews, a lot of people have personal websites attached, and then utilize too. I know that I personally do like 5 to 15-minute free consult calls. So I want to call you and I want for us to be a match for one another.
Right.
I think some people mistakenly, and even when I was starting out, I would be like, I just need clients to fill my caseload and I'll just take on whoever. But it's different. It's I want to be a match for you, but I also want you to be a match for me. If I feel like I can't help you as much as someone else can, or this really isn't my scope, I want to be able to tell you that.
Right.
Yeah.
No, that makes a lot of sense. And that should come from the therapist as well. Like,
Absolutely.
if they're on the hunt for like patients and clients, that might be just like difficult for the person on the other side.
Yeah, it is.
Right. So this is like an interesting question that I just thought of, and I've seen a lot of people do it.
Mm-hmm.
What do you think of people using ChatGPT as a therapist?
I think that ChatGPT can provide a lot of short-term benefits.
Okay.
I think that if you don't understand the way that you're feeling and you feel like, oh my God, I'm alone, I don't know what to do, typing out your symptoms into ChatGPT might be helpful. Maybe it'll come out with a name for you. Maybe it'll come out with some resources. You can type into that, like, what are some self-help resources? What are some articles that I can read? So I think it can be very beneficial. But at the same time, ChatGPT is not human.
Right.
And when you go for therapy, you want to get to know the person. You want that human interaction. You want to be able to read their body language. You want them to read your body language.
Mm-hmm.
There's no way to build rapport with ChatGPT. So I think that it can be helpful and it could almost be a Band-Aid till you find something, but I don't think that people should be relying on it.
Right. I just like looking at it is like it's a machine.
Yeah.
And it doesn't have all the context.
No.
No matter how much you tell it, I've seen that it forgets stuff as well. So it could just be like too deep into the conversation and it's just going to be like talking about something else entirely. It's forgotten about what really happened. And maybe machines can get there someday. I'm not closed off to that option, but if you're having human problems, you kind of have to go to a human who's had similar problems or dealt with people who've had those problems.
Definitely.
So what are some resources that I can just look into before therapy or as a substitute for therapy?
I don't know if I would say substitute, but I think that there are definitely resources. I think that there's some apps that are actually really helpful. There's one called Headspace, and there's another called Calm.
Right.
And that teaches you a lot of mindfulness. And
Right.
mindfulness is strategies that you can practice on your own to kind of help alleviate some of the anxiety or OCD or depressive symptoms that you're experiencing. So they actually have different forms where you can fill out exactly how you're feeling. And you can even then it'll direct you and you can recognize, like, I'm catastrophizing the situation right now.
Right.
I'm ruminating. I'm fortune telling. Like, this is my anxiety. This isn't me. And then there's also some meditation on there. There's some scripts, some guided imagery scripts, which are really great. If you're having trouble sleeping, I definitely recommend the app Calm. And then in terms of like self-help books, there's a great one called The Body Keeps Score. And that's about childhood trauma and how it impacts your attachment style and the way that you interact with other people in your life as an adult. I think that there's some good podcasts out there. There's a lot of them. So I would say find what works for you because there's a lot of options.
You know, when you say that, like, I'm reminded of this book that I read. And it was like my gateway into the self-help book.
Okay.
Whole sphere. Have you heard of that book?
No, tell me about it.
The Subtle Art of Not Giving a Fuck by Mark Manson?
No, it reminds me of the whole Mel Robbins thing.
I'm not aware of that.
Oh, you're not? Okay.
Yeah.
Continue.
But this book is like, I told it to like a lot of my friends that this is how I got into like reading in itself.
Wow.
And they have read that book and they're like, what is this, dude? Like, this is such crass. This is like nothing. But to me, that book is one of the best books of all time. And for a reason, like, it's simple. He goes into the fact, like, for someone who was obsessive like me about things, I was like, oh, if I have to get this work done and I don't do it this way and I do have to do it that way, like, I overthink those things. And he was like, you have a limited number of fucks to give in a day. You have like 5 fucks to give in a day. Please decide on what you want to give it to. So if this thing is not going to matter in like 5 years, you don't have to bother about it today. You don't have to obsess with it. And that's how I got into all of this.
Yeah. And that's what worked for you. I think that's like, a lot of times even when parents come to me and they're frustrated and they're like, this isn't working. These skills that you're giving us, these parenting strategies, they're not helping our child. Sometimes I ask them, just take a step back and realize that we haven't found the right recipe yet. And that can take time, and that can take a lot of trial and errors. But we're going to. I want you to know that I'm confident that we're going to find what works for you and what works for your child. So it's the same thing in terms of that. Like, that worked for you, and that hit for you. Maybe not for everyone else, but that doesn't matter.
That's amazing. Yeah, everyone's different.
Yeah.
So, Julia, you've said so much about therapy. And what is your specialty in therapy?
I think that my passion lies with working with mothers and young children. I think that I developed this passion when I was working at the hospital, and I really learned how important the attachment bond is between a parent and a child. I think that it lays down the foundation for the rest of their life. And I think that if you don't have someone that you can lean on, and there's a famous quote by a British psychiatrist called John Bowlby, and he said that a caregiver needs to be bigger, stronger, and wiser. And if you don't have someone that's bigger and stronger and wiser to guide you in the right direction, to take care of you when you're sick, to hold you when you're crying, then your entire life is going to be affected. And I think that I learned in that moment how important this early work is and how important it is to not only support the child, but also support the parent in every way possible. I think that when you become a parent, you don't realize the role that you're taking on, especially as a mom. You don't realize what pregnancy does to your body. You don't realize that your hormones are all out of whack, that there's a chemical imbalance. In fact, like 1 in 5 women have something called a PMAD. And a PMAD is a perinatal mood and anxiety disorder. And most of the time, this goes untreated. I think what the general public thinks of it as is, oh, that mom is postpartum. And I think postpartum, people associate, like when I tell you what's postpartum, what do you think?
I do have a bit of knowledge on that.
Okay.
And it might just be wrong, but here's what I remember is that when a mom has a baby, there goes a period after when she's had a
Yeah.
baby where she's depressed, and I've also seen videos where the mom is screaming at the baby saying that
Yeah.
I don't want you anymore in my life.
Yeah.
And it's all hormonal is what I've heard. And the mom isn't like doesn't really mean it that way,
Mm-hmm.
but it could go so bad that she actually says that to her baby.
Yeah. I mean, it could go even worse where there's been moms that kill their baby.
Okay.
It can really take such extremes. And a lot of people think of it as the person's depressed, but actually it's a whole wide variety of diagnoses. It's the mom's anxious. There's something called perinatal OCD. There's something called like perinatal depression, postpartum depression. There's all these different diagnoses under one thing. And I think that people also don't realize that postpartum actually goes up to 2 years after the child is born, which a lot of people find like that's crazy. I never thought that.
Even I didn't.
No.
I thought it was like 3 or 6 months.
Yeah, and if people don't get help for something called a PMAD, it doesn't really go away.
Right.
And it's very difficult because the mother is often extremely isolated. She's afraid to ask for help. She wants to do what's best for her child, but also herself, but then she can't think clearly. So I think that this population is such a population that we need to help and that we kind of need to destigmatize some of these preconceived ideas.
No, I completely get what you're saying. Like,
Yeah.
I'm just like comparing things. Like, but I've seen videos of like even animals, like even like dogs, chimpanzees, like any sort of animal when they have their baby, they are so anxiously protective that
Yes.
I've seen animals like actually eat their children.
Yeah.
And we have evolved from animals. Like we
Yes.
are animals, but
Yeah. It's horrible, and it's something that's out of their control a lot of times.
Right.
And it's horrible because a lot of people don't know how to get help. Like, they don't know what's going on. They don't know why they're feeling like this. So I think that if you can be able to help the parent go through this difficult time and support them, then you're also helping the baby. And I think that was one of the most rewarding things that I get to do and that I got to do is that I'm helping two people's futures.
Right.
Like, you're breaking some of these intergenerational cycles because you're giving that child a better future than you had.
So, if you think about it, if a mom is going through all of that, like my thought that comes to my head is that more than the child, the mom needs more help, like on a mental level and like hormonally. If it's such a
Yeah.
big fluctuation that they need help, how can their partner support them?
That's a great question because a lot of times, unfortunately, the partner can get the brunt of it and they don't fully understand what's going on. And I think educating themselves on what's going on, being a part of the process too, a part of that therapeutic process and understanding that this will go away and this isn't permanent and that person's getting help. But I think also stepping up to help your wife. Let's say they're going through, they're having a really hard day and they don't want to be near the baby and that they physically cannot be near the baby at that moment. But then the husband to step in and be like, it's okay, I got her today.
Right.
I got the baby today. I can do it too. I can help you out. And I think it's not all the time, but it's just here and there, like that little help and that little like sign that you're sending to that person. Like, I got you. You're not in this alone. We're in this together. And you just brought this amazing human being into our lives. Of course, the man helped as well, but the woman carried the baby.
Right.
And now you're going to take care of yourself for a little, and I'm going to step up.
But if you think about it, like this shouldn't only happen in the moments where like stuff is going down.
You're right.
This should happen like on
Always.
This reassurance should always be there, especially with all that hormonal fluctuation. It's at that time like they've gone through something so painful, and like the bond that's there between the mom and the child. That's why like they need to step up like entirely. Like it's.
They do.
They don't only have to take care of the baby. They have to
Yeah.
take care of the mom as well.
Yeah. Something that I love now is that you hear about some men taking like leave from work.
Right.
I'm forgetting the name. What
The
is
name of the leave?
Yeah. feel like there's
Why am I blanking out on it?
Let me look it up.
Maternity leave.
Oh,
Paternity leave.
yes.
Yeah.
So what amazes me now is that there's paternity leave.
Right.
100 years ago, I don't think there was such a thing. I think even 20 years ago, 10 years ago, it was pretty unheard of.
Yeah.
But now I hear it all the time. And they love it, some of the dads. Like, some of the dads that I've worked with have told me, like, I am so excited for my paternity leave. This is going to be great. I get to spend time with my baby. It's going to be amazing. And I think that's such an amazing step in the right direction. But there's so much more work that we can do.
Right. I mean, I've also, like, here's the thought I had. Like, I'm nowhere close to having a baby.
Mm-hmm.
But am I given to understand that the maternity and the paternity leave is like a combined thing that the two companies sort of give you?
So you can actually take it at different times, which is really nice. I've worked with families where the mom will take it at first, and then it's kind of her time to go back, and then the dad will take it. So that's really nice because then it gives them both time with the child, and then they can spend a lot of time as a family together and trust that their baby's being taken care of by one of them.
For someone who's not a parent, what is one advice that you'd give them?
I think that people don't care as much as you think. I think a lot of my clients worry so much about confidence and self-esteem, and they overthink so much in a social setting. Like, what is that person thinking of me? Are they judging me? Do I look weird? Do they want to be in this conversation? And the truth is that they don't really care. They're worried about themselves, and they're not even thinking about you. Mm-hmm. So I think if you go into situations and just continue to remind yourself that, then you're going to feel a lot better, and you're going to feel a lot happier in general.
That's really good advice. And Julia, this conversation has been amazing. Like, I've really enjoyed knowing a lot about therapy. Like, I do the podcast to, like, ask questions, but these are a lot of questions that I had in my head about therapy.
Yeah.
And you've answered a lot of them. So before I let you go, what is one piece of advice you want to give to anyone who's hesitant about therapy?
Okay. Well, first of all, thank you so much for having me. I think that this was so amazing when you reached out. This was my first podcast that I've ever done, and this was the first time that I'm speaking about therapy, hopefully, to so many people. Mm-hmm. So I want to thank you for giving me this opportunity.
Of course.
And the final piece of advice that I have for you guys is that sometimes you have to take a few steps back to make a giant leap forward. Sometimes you have to tap back into those childhood memories, into those really hard, uncomfortable, traumatic experiences that you had. And once you can process those, then you can really move forward and be the best version of yourself. Thank you.